Recording in progress.
Are we ready? Okay. Let's go ahead and call the Washoe County District Board of Health meeting together for Thursday, June 22nd, 2023. If we could have roll call.
Christopher Dare, Chair.
I am here.
Devin Reese, Vice Chair.
Here.
Mary Luz Garcia. Here. Michael Brown is absent. Dr. Rika Danko, MD.
Here.
John Clacking.
Here.
And John Novak.
Here.
Very good. We're going to stand if you don't mind joining us for the Pledge of Allegiance. And John, it looks like your arm's working well enough. You want to lead us?
Please face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Play ball.
Okay, we're on to number 3, approval of the agenda. Does anybody have any questions about the agenda? Or do I have a motion?
So moved. Second.
I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye. Aye.
Any opposed? Passes unanimously. Very good. We'll move on to our recognitions. We have our years of service, new hires, promotions, resignations, all the kind of fun. So,
Chair, sorry. If I could get Dr. Clacking and you to vote, please.
oh. Are we all good?
Thank you. Yes.
Thank you. Mine wasn't working last time, so I got in the habit of not using it.
Yeah.
So I will try to pay attention. For you, sir.
Thank you, Mr. Chairman. I'd like to begin with years of service recognition and recognize Nanette Kano. Nanette, if you could please stand. Nanette was hired in the Health District in June of 2018, so 5 years of service with the Health District, but I understand she, with other service in the county previously, 14 years as a Washoe County employee, so congratulations.
Wonderful. And if you stick around, we have this wonderful photo that you can put in your house. We're going to take, so.
And next, I'd like to introduce, but also ask Ms. Dixon to help me with introducing Robert Fida, who is our new Environmental Health Services Division Director. And if you could provide us with an introduction, Erin.
All right. Good afternoon. I am very pleased to introduce Mr. Robert Fida. He came to us from the Southern Nevada Health District. He oversaw public accommodations, subdivisions, solid waste facility plan review, Safe Drinking Water Act compliance, and septic system permitting. He is licensed as a professional engineer and is a registered environmental health specialist. He also serves on the Nevada Board of Professional Engineers and Land Surveyors. He has a BS in chemical engineering from UNR. And at our lunch today, we learned that he was also Stephanie Chen's tutor when he was at UNR, Stephanie Chen from CCHS. He has a master's in biomedical engineering from Columbia University, and he is currently pursuing a PhD in public health from Johns Hopkins University through the Bloomberg Fellows Program. So very excited to have him on board.
Welcome. You want to share anything?
Thank you, board, for such a welcoming introduction, and thank you, Erin, for introducing me. So,
Do you still doing tutoring for any of us in the room?
it's been a while for me. So.
Well, welcome. We would want to say we're very appreciative of our staff, and we could not do any of what happens in our region without you all. So welcome to the team, and I think you have some really good shoes to help guide you along the way. So welcome.
I'm grateful for her tutelage. So,
Wonderful.
All right. Next, I'd like to ask Lisa Lotritz if she could introduce Gustavo Marquez, who's a public health investigator, too, in CCHS.
Good afternoon, Lisa Lotritz, Division Director for CCHS. I would like to introduce Gustavo Marquez. Gustavo is joining us as a public health investigator with the Sexual Health Program. Originally, he's from Watsonville, California, and he's been in Reno since he was 6, so he's basically a native. He attended UNR and graduated in the spring of 2015. He has 8+ years of case management and direct patient service years of experience. Most recently, he was at the Northern Nevada Hopes as their infectious disease Ryan White program coordinator. Gustavo has worked directly with persons living with HIV/AIDS for over 5 years, and public health is his passion. In his free time, he likes to travel, and yay for those Friday travel days. He likes to work out, run, and sometimes lounge around the house. We're glad to welcome Gustavo.
Welcome. Appreciate you being here.
Thank you.
They said you've been in Sparks 6 years, but you should travel to Sparks, because you've been in Reno for so long. Just saying.
All right, so next I'd like to recognize a couple of promotions. Megan Rene has been promoted from Air Quality Management Trainee to Air Quality Management Specialist. Is Megan here? No, okay. Is not able to join us today. Also, Brittany Lucier from an Environmental Health Specialist Trainee to an Environmental Health Specialist. And I don't believe Brittany's able to join us today either. But congratulations to both of them. Have a resignation. Camille Haga has resigned as a program coordinator from the Office of the District Health Officer. Unfortunately, family move out of the area, so we're sad to lose Camille. Thank her for her service here. And have a couple of Washoe County Health Heroes to recognize. Alejandra Rosales with CCHS, and I don't believe Alejandra is able to join us today, but is recognized for adaptability, collaboration, and compassion, 3 of our health district values. And Leah Gardner, who I do think is here. There she is. And thank you for standing, recognizing you for compassion. So congratulations.
Good job.
And then I would like to ask Jasmine Oliveira and Dolly Dillon to present the Extra Mile Award. And I believe we have Mari Hutchinson. Is she here to receive it? Yeah, come on down.
Good afternoon, Chairman, Dare, and board members. I'm Dolly Dillon, a public service intern,
I'm Jasmine Olvera. I'm a community health worker.
and this is Maria Hutchinson, who is the CEO of Step 2. Washoe County Health District's Chronic Disease and Injury Prevention Program is here to recognize a local organization for providing a smoke-free and vape-free environment for their clients, staff, and visitors. We'd like to thank the District Board of Health for joining us in this recognition. 85% of Washoe County adults do not smoke or vape. Therefore, it's no surprise there is growing demand for smoke-free environments. The Extra Mile Award, otherwise known as the EMMA, honors businesses that have gone above and beyond the requirements of the Nevada Clean Indoor Air Act, which creates a smoke-free and vape-free indoor work environment for most businesses. EMMA representatives have made a conscious decision to adopt more comprehensive policies, further protecting community members from secondhand tobacco smoke and e-cigarette aerosol. The EMMA Award has been given since 2008, and this year marks the 33rd EMMA presented to a local business organization.
Today we're honoring Step 2 with an EMMA for their smoke-free and vape-free campus policy, protecting their clients, staff, and visitors from the harms of tobacco, smoke, and vape aerosol. Step 2 is a private and local nonprofit which aims to break the cycle of addiction and violence in families. They've been providing rehabilitation services since 1986 and have helped women develop the skills necessary to help them successfully maintain sobriety. They treat women and children together as a unit for recovery as opposed to treating them individually, with the goal of restoring families and saving lives. On behalf of the Washoe County Health District, we'd like to thank Step 2 for providing a smoke-free and vape-free environment for their clients, staff, and visitors.
Good job. Mari, you want to say something? Sure. give us a little update. I'm very aware of Step 2. It's nice to
Awesome.
see you and all that good stuff. So share a minute if you'd like.
Yeah,
Tell us
I
what
would
you're
love
doing.
to. Thank you for having us, and thank you guys for this award. Step 2 is a smoke and vape-free campus, and it has been for most of the years in our history. We break the norm on sort of the model of rehab programs where people picture chain smoking and coffee drinking. Our women are both caffeine-free and smoke-free. I know.
I'm in trouble.
Everywhere I go, people say the same, but our women don't drink coffee either. We subscribe to the studies that show removing all substances from one system while going through detox and treatment yields better long-term results. So we are proud of our tobacco-free campus. It's not always the most favorite thing of the women on our campus, but during their 3 months in our residential program where they're not able to smoke, they also go through courses surrounding and supporting a smoke-free lifestyle. And so we do that with the hopes that when they leave treatment at Step 2, they will remain smoke-free, both for their health and the health of their children.
Well, thank you for all your work. I don't know if you guys want to share anything? Questions? Well, very good. I want you to know this is caffeine-free tea, by the way. But I do thank you and congratulations.
Thank you.
We're going to take a picture in a minute. You ready?
I think,
Don't go far. I think we're going to take a picture with you.
do you want to do pictures now? And we can do the resolution afterwards? We don't need a picture for this.
Yeah. Let's get a picture.
Yeah.
You're 7 days. 5 years hanging out with us. Come on down. We're doing this one at a time. You were on to put this in your office. Oh, yes.
Here we go. 3, 2, 1. Got it? And 3, 2, 1. Got it? Okay. Come on, Miss Leah.
I didn't know photo was required.
Yes, it is. We don't really.
I was not prepared.
You're prepared, Miss. Looks like you're
I
ready
look
for
like
it.
I've gone camping.
You hold that at the tie as you like.
Here we go. 3, 2, 1. Got it?
sir.
Go for it.
All right. At this time, I'd like to read a resolution that we have for Dr. Stephen C. Zell. Let me get my glasses on.
I understand.
Whereas Stephen C. Zell, MD, has dedicated his life and career in service to Washoe County and Northern Nevada communities by providing high-quality primary health care services. And whereas Stephen C. Zell, MD, dedicated his focus to clinical expertise and compassionate care of HIV/AIDS patients from the very first diagnosed case in Washoe County until now. And whereas Stephen C. Zell, MD, challenged himself to acquire board certification in HIV medicine and additionally in travel medicine to better serve his patients and the community with the highest caliber of acquired medical knowledge and clinical therapeutics. And whereas Stephen C. Zell, MD, worked with the Washoe County Health District clinical team to establish the Early Intervention Clinic in 1989 as a model of preventive health and early diagnosis of HIV/AIDS treatment. And whereas Stephen C. Zell, MD, helped to lead the Washoe County Health District, the University of Nevada School of Medicine, and community partners in 1996 to establish incorporation of the Northern Nevada HIV Outreach Program, which eventually transitioned to become Northern Nevada Hopes, now a federally qualified health center in Reno. And whereas Stephen C. Zell, MD, exemplified his passion for teaching and imparting clinical knowledge with medical residents and health profession students throughout his career with the University of Nevada School of Medicine as a professor of internal medicine emeritus. And whereas Stephen C. Zell, MD, immediately responded to engage in community health and practitioner safety precautions and public health protections with the emergence of the SARS-CoV-2 pandemic. And whereas Stephen C. Zell, MD, provided his expertise and guidance in public health to those practitioners, nursing staff, educators, and caregivers at the Washoe County Health District to deliver high quality and best practices in primary care prevention, education, and service to the Washoe County community. Resolved that the Washoe County District Board of Health recognizes Stephen C. Zell, MD, for 40 years of commitment to public health, and in recognition of the service, the board designates the Community and Clinical Services Consultation Room as the Dr. Stephen C. Zell Consultation Room, adopted this 22nd day of June, 2023. Signed, Christopher Dare, Chairman, Washoe County District Board of Health. If I could provide a little explanation. Dr. Zell is not here with us today because this is something that we are going to present to him on Saturday at a celebration for what he doesn't want to call his retirement, for his service to our community and to the health district. And so this is something we want to do to recognize him, and I'll present the resolution to him on Saturday.
Very good. Any questions? Very good. Thank you. I have a first. Second. I have a second and a third. And any discussion? All in favor? Aye. Any opposed? Passes unanimously. And look forward to, you'll get a picture and show us?
I will do that.
Thank you. Very good. Thank you. We got to push the buttons. Okay, we're on to public comment. Is there any public comment? Anybody like to share? Cool.
We don't have any public comment today.
Very good. Moving on to consent items. Is there anybody who'd like to pull a consent item? Seeing none, do you have a motion? I have a motion on the table. Second?
Second.
I have a first and a second. Any other discussion? Seeing none. All in favor? Aye. Any opposed? None. That passes unanimously. Moving on to recommendations for the board citations appeal to the air pollution.
No,
Am I right? No, actually, we're way past that.
We're on to
Regional.
the Inter-Hospital Coordinating Council.
Yeah, there you go.
Chair,
Thank you.
can I get your vote, please?
Trying to find my way here. Very good. So we're on to Interhospital Coordinating Council. Presentation of accomplishments. Is that what we're at?
Yes.
Very good. Come on down. This is number 8. I'm a little confused too. Let's lay down.
Jordan and her staff.
Exactly.
You brought a gang with you.
I did.
You got backup.
Good afternoon, Chair Dare and members of the board. My name is Jordan Markey, Public Health Emergency Response Coordinator and the coordinator of the Interhospital Coordinating Council. With me today, I have Zeb Namora, the EMS coordinator at Truckee Meadows Fire Protection District, Brian Taylor, the emergency manager at REMSA and our current chair of IHCC, and Kent Choma, our member at large for IHCC and the Northern Nevada Health System Market Director of Plant Operations. Zeb Namora is also our vice chair of IHCC. Today, Brian will be presenting on the accomplishments of IHCC done throughout the fiscal year of 2022 to 2023.
Good afternoon, Chair Dare, District Health Officer Dick, and board members. My name is Brian Taylor, and as she stated, I do work for REMSA full-time, and I am their emergency manager. But today, I have the pleasure and honor of presenting to you on behalf of the Inter-Hospital Coordinating Council and presenting specifically our accomplishments for this fiscal year. I wanted to, let me put this up a little bit, sorry. I wanted to first do a little explanation of what the IHCC is. So let's turn to the next slide if we could, please. How do we do that? Oh, perfect. Look at that. Okay. There we go. Okay, so this is a kind of a neat graphic depicting what the IHCC does and who's part of it. It's a healthcare coalition, which a few years ago was mandated by the federal government that certain communities have these healthcare coalitions. But the IHCC is much more vast than that. We, a little bit of our history for some of the members that may not be familiar with the IHCC. The purpose of this healthcare coalition is to collaborate and coordinate efforts of healthcare facilities, community stakeholders to mitigate against and prepare for disasters, incidents that happen like mass casualty incidents, different kinds of community disasters that happen. But we began way before that. We began as a partnership of Washoe County Health District, REMSA, Renown Health, and St. Mary's, which at the time in 1985, and I was actually here at that time, dating myself a little bit, but I was working in EMS at that time. We had a very big incident, the Galaxy plane crash in 1985, and we realized with that we weren't as coordinated as we thought we were, so we kind of put together that group. And then in 1994, we gave it its name, which was the Inter-Hospital Coordinating Council. So quite a few, like 20 or so years before the federal government was even talking about that. We include over 122 partners at this time, and it includes fire, EMS, acute care facilities, skilled nursing facilities. This next slide kind of depicts what we do, and we take a community approach. Very collaborative, just like Washoe County is. Where, as you guys know, because you guys are over this area as far as the District Board of Health, you understand that we're kind of an island unto ourselves. There's not a lot of cavalry troops, so to speak, that will be coming if we call for help, other than some of our outlying agencies that help us a lot. There's a lot of area between us and any other big agencies. So, like in Sacramento and so on and so forth. So we had to get together collaboratively and provide each other assistance, even across the borders of different hospitals, different healthcare facilities, different skilled nursing facilities that may in a normal time kind of compete against each other. We found a way through emergency management where we actually completely help each other. So we take an all community systems approach. Some of the things that I'm going to talk to you guys about today and this last year that we did, this is a little overview of it, National Disaster Management Systems. We'll get into that a little bit more. WebEOC, or Emergency Operating Center, Multi-Casualty Incident and Alpha Plans, which are the mass casualty incident plans here locally as they stage up to the Alpha Plan, which is the top plan or the most patients that we might see. Alternative Care Site Review Plan, Coalition Member Resource and Gap Analysis. We take a system-wide approach at that when we take a look at that. And the triennial exercise that a lot of you guys knew happened just about maybe 3 or 4 weeks ago at the airport, where we do a full-scale mass casualty incident involving all the responding agencies. So let's first talk about the NDMS. This was brought on by, or approached to us by the federal government, specifically the VA side of the federal government. And this plan is a federal plan by which, there may be a disaster in a place like a hurricane or something like that in the South, and some of the veterans that were in facilities down there cannot be housed close to them, cannot be transported by ground close to them. So they have a plan by which they put a significant amount of patients in the C-130, and they fly them to a region that has ahead of time agreed to accept those patients and house them and take care of them within our healthcare facility here in Reno and Sparks and all of Washoe County. So we exercise this plan by using a lot of different partners. All the hospitals were receiving facilities. We had Washoe County Health District members that were very, very involved. PHP, other people that assisted in this. We did it over at the airport at the National Guard hangar, and it was very, very well done. It was very well tracked. All the patients were tracked. We had actual live patients there. We simulated transport, but we actually had some really good actors, and we found out a lot of things, a lot of gaps that they need to figure out. But I want to tell you that our system and our patient tracking system was a best practice for them. They took a look at this from the federal government side and said, wow, we really need to make sure that our system talks with this system, because Washoe County has really got this, got this figured out, and it's got it down. So we did that. You guys understand the triennial exercise. Every 3 years at the airport, they have a mass casualty incident with moulage actors, very good actors, as a matter of fact. And they really test the system, test all the responders. We work together like we would in a real mass casualty incident if there was a plane crash or something like that happens. And the outcome was good. There's a good opportunity for us to understand maybe what gaps we might have in the areas to improve those gaps, improve the plan, and then we exercise it again. We transported over 122 patients in that period of time, so it was quite a big exercise. So other trainings that we do, this is not just the big exercises and things where we test our plans. We do lots of trainings in the area, and alternate EOC exercise we did this last year, anthrax planning meeting, Burning Man, tabletop exercise. A lot of different ones up here. I won't mention them all because you can read them, but we went to the Preparedness Summit down in Anaheim this year, and we are right on task with what all the best agencies in the nation are producing in their areas. There's no huge county like LA County or any other that have anything over us here in Washoe County. I can tell you by my interaction with some of those representatives down there that they were taking notes when we were talking about some of the things that we do. And I pat ourselves on the back because I'm the representative of our coalition, but also understanding that we go to those things in order to glean off best practices in other areas. We bring them right here and we test them out, but it's not a one-size-fits-all, as you guys understand. It's a one-size-fits-one, because Washoe County is very, very unique, and we make sure that we take that into account, and all of our shareholders in the area, as far as responders and healthcare facilities, work together to make those best practices and plans our own. We also did a WebEOC update. That's Obviously, it's web-based, but it's emergency operating center that we can do specific things in the region. All you need is access to the internet anywhere actually in the world, and there's different positions that we are trained to. And one of the ones that I want to talk about through the IHCC side is the Patient Tracking Board, which the Washoe County Health District assigns a person to take that position, and that'll track patients, whether it's a hospital evacuation in DMS, or also the biggest situation that we use that patient tracking with is for a mass casualty incident. You get a patient on scene, we send, the transporting agencies send health district the information from that patient as we transport them, and then they're tracked through the hospitals. And so the next day or even that evening, you know, when, say, a relative would call and they would ask where Uncle John is, we can tell them where Uncle John is so that they can make that connection through the Family Assistance Center. We also, again, take a community approach on the hazards and vulnerability assessments. Each hospital, each care facility, skilled nursing facility, and some of the other large businesses in the area have to have a HVA as part of their governing body, insurance company, or whatever. They have to put together a hazards and vulnerability assessment. Within the IHCC, we review those assessments as a group, and we see how we can help out. We have subject matter experts in our coalition that will jump across the lines and even talk to even a competitor and tell them these are some of the things that are best practices. These are some of the plans that we've put together. Take pieces out of that. We don't have any problem with that, and use them in your facility, because our goal is to be regionally prepared and not be in silos. So some of the gaps we understood in that the last HVA that we did as a community, as IHCC group, are listed up here. I don't think it's as important to see what's listed under where as it is to understand that we work on this as a group. So even though it says EMS and fire, we absolutely work on that together. The hospitals jump in and help us with their side of it. The skilled nursing facilities help us in their, you might think, how would a skilled nursing facility help in that? But a skilled nursing facility might be able to take patients from the hospital in a time of emergency that are appropriate so that the hospital could create more capacity for, say, a mass casualty incident or something like that. So that's kind of the way that we collaborate together. So in conclusion, I just want to let you guys know again that that this is in my heart. It's been in my heart in the 40 years that I've participated or been part of the emergency medical system here, or the emergency medical services here in town. I started out as an EMT. I was an AMT. I've been a paramedic, and have devoted my entire career to emergency medical services in this region. And with the IHCC, it is just such a great collaborative effort. We don't have arguments. Matter of fact, our motto is that this isn't the meeting that you have to go to. This is the meeting that you want to go to, and everybody agrees to that in our group. And in that group, it's just such a great collaborative effort. This is my second stint as the chair, and next year you'll be met up here by Zeb. He'll move on to the chair position, and I just want to let you guys know from my heart that this is a great organization within your region here, and we stand ready for any situation that can come upon us with medical related situations that are associated with victims that may have happened or have been created by a disaster. So thank you very much, and I'll take any questions if you have any.
Well, thank you for your service over the years. I've seen you come in and share with us, and so thank you. I think Zeb is going to be a very good fit, so I think that's fantastic. And let's open it up. Anybody want to share anything? Questions? Sure. John Novak.
You bet I want to share with it. I've known Brian and this whole crew for 6-7 years now, and I really would like to have board members at least come by one of the meetings. They're usually the second Friday of the month, and it is an incredible group of people that do an incredible amount of things. and Brian didn't even hardly touch on what they really do. We have the ham operators in there. We have supplies. They buy a lot. There's a lot of little things right now. Something little like triage tags. Now it's basically there's one triage tag for everybody in Washoe County. It's going to work that way. But it's that coordination that comes down. The people are enthused, and yes, it's the meeting I want to go to. Thank you all. It is absolutely a pleasure to come to your meeting sometimes.
So I do want to say thank you for the invite. I didn't get to go to the airport this time. I wanted to so badly. But please, whenever you have your next one, I remember once John and I went down and they were painting people. I'm just telling you, if you guys are interested in going down something pretty cool, this thing's pretty cool. And if you have the time to get real messy, they'll make it look like you lost an arm or something crazy and get to run around. But I got to do some role play as well. And I think it's so important. And it also it's really, I can tell you as electeds, but also even those who are non-elected, our goal is to not be in silos and to work together. Foolishly, we would be foolish if we think we can do this on our own. So what you do in 122 different groups, you said, that's amazing. So Congratulations, great job. Go ahead, sir.
I just wanted to remind the board members and some new board members that weren't here that you don't just have to listen to what Brian and Dr. Novak are saying about IHCC. It's a nationally recognized hospital coordinating council. In 2019, I believe it was, we received the national award from ASPR and NACCHO for our hospital preparedness activities because of the work of the IHCC. So it's a fantastic organization and nationally recognized.
So I'll ask one question. We can go ahead and go too deep in this. We have other things, but on your according to this, it looks like earthquake would be our biggest difficulty. Am I correct on that?
Absolutely, and that would be a region-wide response. So it would be more difficult not only in patients, but it would also be difficult in different areas you have to respond to. So
that would be one of the things that I think we'd be interested in. If that's some of our biggest weaknesses you guys have found, if there's anything that you guys in the future think, hey, here's some areas that we can shore up, please let us know.
Great, and I just wanted to comment on what Health Officer Dick mentioned there. I actually went to Washington, D.C. and spoke on stage at the National ASPR Convention, talking to them about creating healthcare coalitions on behalf of our group here. So you're absolutely correct, and just know that we continue to strive for that excellence in our community because that's what our community deserves and what they need.
Thanks so much. You need to have a motion on this, or it's just a report? I think so. Great job. Good job, Gary. Come on, everybody. Saving lives. Fantastic.
Chair, we actually do have to accept that.
We do need to accept. Okay, that is fine.
Oh, no, sorry, it's the next one. I'm so sorry.
We accept it no matter what happened. We love it. Okay, number 9, presentation acceptance of the Washoe County, Nevada Air Quality Trends 2013 to 2022. Craig Peterson. It's a nice tie, sir. Yeah, I see that.
Good afternoon, Chairman and members of the board. My name is Craig Peterson, and I'm the Monitoring and Planning Supervisor for the Air Quality Management Division. The Trends Report. The Trends Report is a summary of millions of data points collected by our ambient air monitoring network each year. I'd like to introduce Mr. Brendan Schneider. You've probably met him before, but Brendan has been our data manager for the past decade or so. He ensures that each data point is of the highest quality so that we can make the best decisions possible in the Air Quality Management Division. Brendan is also the project manager for this Trends Report and is here to present some information on our latest report. Thank you, Brendan.
Will you state your name again, Brendan?
Yeah, Brendan Schneider.
Nice to meet you, sir.
Nice to meet you. Okay. So good afternoon, Chair, Vice Chair, and members of the board. Again, my name is Brendan Schneider. I'm a Senior Air Quality Specialist in our planning branch of air quality. and I'm here to present to you the 2013 to 2022 Air Quality Trends Report for Washoe County. The Clean Air Act requires the Environmental Protection Agency to establish national ambient air quality standards, known as NAAQS, for pollutants considered harmful to public health and the environment. Currently, there are 6 criteria pollutants: carbon monoxide, ozone, particulate matter, nitrogen dioxide, sulfur dioxide, and lead. We monitor for all of these pollutants except for lead every hour of every day. The Trends Report is completed every year to fulfill the requirements of our federally approved Quality Assurance Project Plan, known as the QAP. We have done a Trends Report every year since 1989. This report details the ambient air quality data and information for the criteria pollutants over the last year and the trends in the data over the last 10 years. This is the Air Quality Index monthly summary for last year. It shows the highest daily AQIs by the month. Despite a cold winter, we issued only 5 yellow burn codes and haven't had an exceedance, also known as an unhealthy for sensitive groups or USG day, in the winter since 2013. This shows the effectiveness of our longstanding wood-burning device regulations in helping keep our air clean during our historically worst air quality season, which is the wintertime. In 2022, we had 229 good, 127 moderate, 1 USG, 6 unhealthy, and 2 very unhealthy days. The mosquito fire in September was the main cause of the unhealthy and very unhealthy days. This is the 10-year AQI trend. It shows the highest daily AQIs by year. Although we have made improvements in the wintertime, it has become harder to see the improvement due to the wildfire smoke. Increases in population and vehicle miles traveled from cars and trucks on the roads have also caused USG ozone days in the summertime. Motor vehicles remain the #1 source of local air pollution in Washoe County. So I wanted to highlight this one figure from our trends report. This is the annual PM 2.5 design value chart in trend. It shows that our area will likely add another NAAQS to the 3 that Washoe County are currently in violation of, including 2015 8-hour ozone, 2006 24-hour PM 2.5, and PM 10. The EPA is currently reviewing public comment for strengthening the annual PM 2.5 NAAQS from 12 to between 9 and 10 micrograms per cubic meter, which is shown in the new NAAQS rectangle in the figure. 3 of the 4 PM 2.5 monitors that we have in our network would not meet the proposed NAAQS levels. These NAAQS violations of the PM 2.5 annual standard are mainly due to wildfire smoke impacts, and the data may be excluded from regulatory and planning decision-making via exceptional event demonstrations. So, main takeaways. Air pollution levels in Washoe County have improved in the wintertime over the last 10 years due to wood-burning device regulations and programs like the Burn Code. Air pollution in the summertime is getting worse due to wildfire smoke and local sources like motor vehicles. The Trends Report is an ambient air quality data report used to help make air quality planning decisions and set priorities for future emission reduction strategies. And with that, I can take any questions you may have.
Any questions, concerns, thoughts? Thank you for this report. One of the things we want to continue to make sure that we see, but all of the millions of people watching on YouTube or wherever that is just how important this is. One of the things that's happening, and if you want to speak to this for a second, is not only do we have a problem because we have more population, which creates more pollution. Mm-hmm. However, it's also getting more strict on, you have what was expected out of us potentially is also going to become more constricting, if I'm not mistaken. So do you have anything you want to share about that? Because I think
Sure.
it's important we keep an eye on that. It will affect businesses that are coming into Reno Sparks, Washoe County, and we've already seen businesses not come here because of this.
So the ambient air quality standards get revised or looked at every 5 years, and it's also sort of a moving target in which if they set standards low enough, we might have to implement new strategies to reduce emissions, which could be a burden on business and residents themselves as well.
Very good. Thank you so much. And we do need, oh, sir.
Just one comment. After reading your report, thank you for such a good report. It defines, if you haven't looked at it, it defines on which everything is, where the particles are, where carbon dioxide, everything works in, and it's very well explained. And that right now was very important. Now I know exactly what some of the things you're quoting, why it's important. But thank you for a great report there.
Thank you.
Appreciate it. Okay, I'm looking for a motion to accept. I have a first. Do I have a second?
Second.
Any more discussion? Seeing none, all in favor? Aye. Any opposed? Passes unanimously. You all did a great job. Thank you. See you next year. I'm just kidding. Hopefully sooner. I'll get there, I promise. So we have number 10, presentation, chronic disease and injury prevention for youth vaping.
Commissioner Garcia, can I get your vote, please?
Lisa Sheritz?
Yes.
Hi, come on down.
Good afternoon, Chairman Dare and board members. My name is Lisa Sheritz. I am a health educator in the chronic disease and injury prevention program in the Community and Clinical Health Services Division here at the Health District. And I'm here to talk about the youth vaping epidemic in Washoe County. And I looked up epidemic just to make sure that I wasn't getting dramatic. And that means a disproportionately large number of the population is using or is affected by. So tobacco control works with product price increases and smoke-free protections, cessation access, and hard-hitting media campaigns, and also retail access. And all of these impact the availability of e-cigarettes to youth. So what I'd like to do this afternoon is tell you what e-cigarettes are, briefly, show what the numbers are in here in Washoe County, in Nevada, and what we're doing about it here at the Washoe County Health District. So e-cigarettes deliver high concentrations of nicotine very fast. I know that some e-cigarettes are marketed as cessation devices. They are not marketed that way to youth. The talk about, or the debate about whether e-cigarettes are less harmful than smoking tobacco can be held another day, but this is just about youth access, and there is no safe level of youth use of nicotine. Nicotine, when it impacts the developing brain, the brain tries to stabilize and grows nicotine receptors. And that creates the dependence on nicotine. And with the smoothness of delivery that e-cigarettes produce, there's no harshness in your throat. They're easy to hide. And many of the flavors are very attractive to youth. So what we've learned is a lot of times when you see students in schools, in middle school and high school, going like that, they're not doing a BO check. They're actually exhaling the aerosol from e-cigarettes. So if you have teens at your house, look for the smell of air freshener. And strawberry and blueberry. If your teen son's room suddenly smells like lemon mint, you might want to look and have a talk about e-cigarettes with them. youth are not smoking traditional cigarettes. They have gotten the memo that smoking kills, that it's stinky, and that it costs a lot of money, and that it can addict you. Unfortunately, they haven't gotten the memo about e-cigarettes, but we're trying. On social media and also just regular advertising, e-cigarette companies are portraying youth, fun, parties, consumption of e-cigarettes by cool people. And then the youth themselves on social media reproduce those. So it's very challenging to counter those messages. One thing that nicotine does is it's similar, especially for youth. If you've ever been stopped at a stoplight and the car next to you is revving its engine, that's what nicotine does. It closes down the circulatory, tightens it up, and makes your heart beat faster. Behaviorally, for youth, the mood swings that we're familiar with teens are increased with nicotine, the cravings, the hamster wheel of use, and then feeling sated, and then craving again. And e-cigarettes allow, a regular cigarette maybe has 10 hits off of it. E-cigarettes could have up to 200 hits, and so that's a pack of cigarettes, and students don't realize that when they're hitting on e-cigarettes throughout the day at school. And then the harm of youth e-cigarette use. I know this slide is very packed with information. Just think how annoying it would be if you were in a classroom craving nicotine in high school. Because there's a lot of behavioral health impact of not being able to focus because of the e-cigarette use in high schools. A lot of students are going to the bathroom more than usual to take hits in the bathroom. So heating the nicotine creates carcinogens. E-cigarette use renormalizes kind of smoking or using something outside of yourself as not only an experience, but also to calm down, to reduce stress. We try to tell students that there is that stress of the hamster wheel of addiction, let alone just being a high school student with its own stress, and that it's a short-term solution to poise that you'll need throughout your life. And why do teens use? Because there's so many flavors. There is infinite consumer choice, over 15,000 flavors. And one thing about e-cigarettes is not only can they add nicotine juice or liquid e-juice, also other substances, THC, and other substances can be added into e-cigarettes. And so it creates a problem in schools because if students, when, say, as a student is caught and their e-cigarette is confiscated, it's hard for schools to tell whether it's THC in there or tobacco or what. And then a lot of students don't know if there is THC in there, it could be a felony. School officials we had a call on the Tobacco Control Coalition yesterday with some school officials, and we asked the question, would you say vaping prevention is in the top 5 of your issues? And they said no, probably in the top 3 because of the staff time necessary to intervene when e-cigarettes are being used either in the classroom or in the lavatories. So here in Washoe County, let's see. So the Youth Risk Behavioral Survey is done every 2 years. You can see that, and the use of combustible cigarettes by high school students or middle school students is probably about 2%. High school students, it's between 4 and 7%. But here, this is middle school, so that's age 11 through 13. Ever used? Being curious, that's natural at that age. And then used 30 days before the survey, that indicates chronic use. So you can see that these are alarming numbers at a very young age to be using nicotine and what it does to your brain and body. And then high school. You can see high school, again, the curiosity and the self-mastery that is age-appropriate. With all the different flavors of e-cigarettes, youth are trying them at alarming rate and also becoming chronic users of them. The adult tobacco use in Nevada is around 15%, and the adult use of e-cigarettes in Nevada is around 4%. So you can see that there's incredible consumption going on in high schools. And then Principal Freeman Holbrook, who's the principal of McQueen High School, was going to be here today, but he's delayed traveling and won't be able to join us. But he's the principal of the Washoe County School Principals Association, and he recently had an article in the Reno Gazette-Journal about closing the flavor loophole in e-cigarettes because of the attractiveness of flavors in e-cigarettes. And the flavoring also is disproportionately affects certain communities, which creates health inequities. So some things we're doing, we have a website for parents' education, Let's Talk Vaping. We also have for students, Behind the Haze. It's a website and also commercials on TV. And then we're also part of a partnership with Southern Nevada Health District, Carson City Health and Human Services, and the rural partnerships to maintain a website about flavoring, because a flavor ban is doable at the state level, and also the FDA is considering it, but we could all be retired by the time that they decide. So if we have the ability to make a flavor ban, that would curtail student use, because almost all students say there's no way they would use e-cigarettes unless there were all the flavors. Then we also have cessation access to a Nevada-specific My Life, My Quit. It's teen addiction, or they're addiction counselors who are specialized in teen addiction, and they can do counseling by text or on the phone coaching. And then, of course, there's always the cessation of 1-800-QUIT-NOW. So, any questions?
Anybody with questions, concerns? So one of my questions is, all these kids become adults, and then we have not just a kid problem, we have an adult. Do we know the effects of, is it similar cancer-wise? I mean, I know it affects the lungs. I've seen that stats. But it does seem like adults do seem, the ones that I know vape, seem to think it's a better alternative over them smoking. So it's kind of like a nicotine patch or something in their mind. I don't agree with that, but I'm just telling you what seems to be out there. But we are going to have a health. It's a matter of years. If this stays an addiction for these students, then we're creating a new adult problem, it seems.
That's a great point and a great question. We don't know the long-term effects because they came on the market in 2007 and really hit big time around 2014. So we're, with cigarettes, we had how many years to see all the effects of cigarettes? So you're absolutely right. We'll have to wait and see. Lungs are still growing until you're 25. So that's why we're trying to intercept the students and say, wait later. Nicotine won't affect your brain the same way, and it won't affect your lungs the same way.
Thank you.
Yeah, thank you.
Okay. Do we need to accept this, or is this just a report? Thank you so much for coming. Appreciate it.
Thank you very much for listening. I appreciate it.
Okay, thank you so much for being here. We still have a quorum, so. Regional Emergency and Medical Services Authority, come on down. Is that you, Barry? Congratulations to you and your daughter.
Thank you very much, sir. Good afternoon, Chairman Dare, members of the board. I'm Barry Duplantis, CEO and President of REMSA for the record. I understand that you have been provided with a copy of REMSA Health's May 2023 report. I'd like to highlight that for the month of May 2023 and for the fiscal year to date, REMSA Health was compliant with Priority 1 calls in Zones A and Zones B, C, and D. Additionally, I'd like to point out that as we embark on our busy season of the year, that our staffing is in exceptional position to address all of the special events in our area, and we do not expect to draw from 911 resources to cover special events. We continue to experience year-over-year growth, as I've pointed out in the past, and even as we speak today, I can candidly say that our system is about 6% busier this year than it was last year. I'm happy to address any additional questions or comments that you may have.
Any questions, concerns? We don't have any. Thank you so much. I'm looking for a motion to accept.
So moved.
I have first. Do I have a second? Second. And any other discussion? Seeing none, all in favor? Aye. Passes unanimously. Thank you.
Thank you.
Okay, we are moving on. And I think this goes to Lexia Jobson. Thank you for being here. And we have our update of REMSA Health's public relations. It was a great party to come and join you at.
Good. Thank you for being there. Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for the record. You have for your review May's Public Relations Report, and I'd like to share a couple of other more recent updates with you. Earlier this month, we hosted our annual Summer Safety Press Conference to remind the community about the importance of not leaving children alone in or around hot cars. The importance of designating a water watcher and recognizing the signs of heat-related illness. We created a mock pediatric drowning scenario and had an ALS crew respond as if it were an actual call. Subject matter experts from clinical services and education provided media interviews, and we received coverage on all 3 television stations as well as KUNR. At the beginning of June, Nevada Peer Support Network enlisted the assistance of REMSA Health Dispatch to notify them when other PSAPs and first response agencies request them to respond to an incident. Our care coordinator team will primarily be responsible for making these notifications, which are about 1 to 2 per week. We are proud to assist Nevada Peer Support Network in this way, particularly for a resource that is so meaningful to first responders across the region. Next week, leaders from the organization will travel to the American Ambulance Association's annual conference, which will be held in Las Vegas. This year, these leaders will present across 3 different sessions, represent the organization within the National AAA Board meeting and State Association conversations. But most importantly, our Center for Integrated Health and Community Education Manager, Jenny Walters, will be celebrated by the AAA as an EMS Next honoree, a distinction that recognizes future leaders and thinkers in the EMS profession. And as a small digression from franchise-related business, we would like to express our sincere appreciation to Sheriff Balaam and the Washoe County Sheriff's Office for raising and donating such a generous gift to benefit the colleagues and family members of our team members who were lost in the Care Flight accident earlier this year. I'm available to answer any questions you might have.
Any questions, thoughts? Anybody? Very good. Thank you for your update.
Thank you.
Really appreciate it. And we're moving on to our discussion and possible approval of the REMSA franchise compliance checklist with an effective date of July 1st, 2023. Andrea S.
Good afternoon, our Chair Dare and members of the board. Andrea S., Public Health Preparedness and EMS Program Manager for the record. Today I'm presenting to you on the proposed changes to the REMSA franchise compliance checklist. You should all have a copy of the revisions. There are a few I would like to call to your attention. On page One, the 2.3 is just the addition of BLS transfer policy. This is something that happened in result of the franchise revision that was approved in February of 2023. On page 16, 12.2, there's the addition of the MSAB quarterly reports, and that outlines the information that will be presented at MSAB. So just more thorough report, and that was discussed among all EMS and fire agencies. And
recording in progress.
Page 17, 12.3.
Recording stopped.
All right. 12.3 just outlines daily staffing reports. So these are reports that come to the
recording in progress
agencies on a daily basis for a better understanding of staffing among with REMSA each day, so they can better plan for response. There are 3 additional revisions that I would also like to discuss. On page 2, there's the inclusion of the QI and QA going through the JAC, so it's the Joint Advisory Committee, which is made up of REMSA and fire agencies. On page 6, we mention, as we mentioned last month in the DBOH report, that the zone map that is updated every year will actually come to MSAB and DBOH regardless of any proposed changes. That way we are being transparent about the current map. In previous years, this map did not go to MSAB or DBOH every year if there was no revision. So it will come every year for approval. And then lastly, on page 9, we now include the inclusion of the CPI letter is also applicable to the subcontractors of REMSA. And that is just to open up more transparency. So all the revisions that were made are really just to eliminate any confusion, questioning, or allowing interpretation of what the checklist states. And with that, I would be happy to answer any questions that you may have.
Any questions? No. Thank you so much. This is very good, and I do think, so when you're done with this, do we get to see a copy of this? Is that how that goes, or does it just go into the world?
Well, you have a clean copy of this without the track changes, and so that copy is in your packet, and then this copy will just be given to REMSA.
As they go forward.
Yep.
I really do appreciate REMSA and the ability, and I think everybody's doing this right now, transparency of what's happening and collaboration of working together. So I want to continue to share that on, but recognize it as well. So thank you.
Thank you.
And we are looking for an acceptance of this. Have a motion? So I have a first, a second. Shaking your head doesn't constitute as a first, by the way. All in favor? Aye. Any opposed? See none, it passes unanimously, and I'm pushing my button, Mr. Reese. So we are now on 12, presentation and possible acceptance of the 2022-2025 Community Health Improvement Plan. Ms. Julia Ratty.
Hello.
Hello, hello.
My name is Julia Reddy. I'm the Director of Programs and Projects here at the Washoe County Health District, and I'm here today with the distinct honor of presenting the work of our community on our Community Health Improvement Plan. So thank you for the opportunity. A Community Health Improvement Plan is our initiative to address public health challenges based on the results of our Community Health Assessment. So I'll ask you to think back to the November retreat when you saw the results of the Community Health Assessment. And community input. So there's a significant amount of community engagement and community input that goes into this process, and our plan is typically updated every 3 to 5 years. We do this because it's best practice. It's a wonderful way to engage our community in planning for our community's health improvement. It also happens to be one of the things that we are required to do for accreditation. So just as a reminder of the full process, you've seen this before, again, back in November at the retreat, the first 2 steps. And so starting with the community health assessment, there's a steering committee for our community health assessment. We had 7 meetings from January through June, doing a lot of informing, collecting information, had 100 different points of interest looked at in the community assessment process. Most of this is led by our epidemiology team here at the Health District with the wonderful set of skills that they have both with assessment and data and data analysis. We looked at primary and secondary data, so that included both community indicators and data that is available like the youth risk behavioral health survey that you just heard about, but also primary data, focus groups, surveys, those kinds of things. 641 people replied to our survey, 50 joined focus groups to give us information, and then that information was collected, organized, and scored by our epidemiology team. Then this year, as a bridge between the community health assessment and the community health improvement plan with a health equity lens, we did a listening tour, and we presented again these results to you back at the board retreat in November. Those were 29 sessions with different community-based organizations, including just under 60 individuals that we talked to who were in leadership positions across the community. They generally validated what we had learned through the more formal community health assessment, but gave us some nuance and information, looking at it from different points of view within our community. And then we moved into the community health improvement planning. So we started with one big forum, about 150 people in a room, with some wonderful exercises, a dotmocracy where you could do lots of different voting using lots of different dots to help us identify priorities. Again, a steering committee to help take all of that information. So all of that information from the community health assessment, the listening tour, that community forum, to organize that, to prioritize that. That steering committee helped us land on 4 key priority areas. And then we worked with community forums and committees to build out the rest of the plan. So it's a large, extensive community engagement process with a lot of partnership with our community. One thing that I want to point out here is, as we're going to jump into the focus areas for the plan, this is a community engagement process that leads to these focus priorities. It is the health districts and the community's community health improvement plan. There are lots of other ways that the health districts partners with the community, and today was a perfect day to do this because you saw the Inter-Hospital Coordinating Committee and the broad partnership that we have there. You saw the tobacco presentation and all the community work organizations that we're working with here. So want to acknowledge that there are lots of other places within the health district that we accomplish our strategic goals and our outcomes and initiatives through partnership. This is a distinct set of activities that are focused on a community engagement priority where the community identifies what areas we're going to work on. So that's the distinction. There's no more important or less important in the plan, just that the process that we get to of what we're going to work on is a bit different in this one. So here's your CHIP steering committee. We had wonderful representation from across the community. We had the school district. We had, again, different community-based organizations, Truckee Meadows Tomorrow, EDON, and the Chamber. So a good broad cross-section with diversity of background, diversity of enterprise, all kinds of good representation on the committee to make these priority decisions. So what they came up with is 4 focus areas that we are working on in this year's CHIP: mental health, preventative health behaviors, access to health care, and social determinants of health. This year we had one piece that was just a little bit different, which was strong recognition that transportation and language accessibility are cross-cutting issues that are affecting our ability to be successful across all of the different sectors. And so we are asking, as we're developing each of these programs and initiatives and plans, that people are thinking about transportation and language accessibility embedded within the plan. And then there was also strong desire to work on language accessibility across the board as a separate initiative. Thinking about tackling language accessibility across the community is a bit daunting. So we're starting with some things that we think we can get our hands around, and then we'll move forward from there. So those are our 4 focus areas, 1 special initiative, and 2 cross-cutting considerations. So I am not going to, the rest of these slides are the entirety of the plan, goals, and areas. I'm not going to read them all to you. I'm just going to highlight a few for you. You do have the full community health improvement plan in your packet for approval. But just to give you some highlights, so for example, in social determinants of health, 2 areas of focus. One was on affordable rental housing, the other one on healthy access to food or food security. Several different initiatives in housing. What we're seeing is that the lead agency in our community is the continuum of care. So we're working closely with out of the manager's office and the community-wide collaboration coming out of the community of care focused specifically on homeless individuals, and really looking at tenancy support and landlord engagement as part of our efforts with the continuum of care. Moving on to mental health. Once again, mental health has 2 pages of initiatives. There's still tremendous energy in our community around addressing the issues of mental health. By our FAB standards, we're required to do some policy level initiatives. So the first one that you'll see is an initiative that came out of the Washoe County Regional Behavioral Health Board, which was a bill to try to get tuition reimbursement to address the shortage of mental health professionals that we have in our community. Unfortunately, AB 69 did not make it out of the legislature successfully, but the good news is that AB 45 did, and that is another tuition reimbursement bill that came from the Treasurer's Office. It was actually more money. It's just more broadly includes all healthcare providers, but it does include behavioral health providers. So hopefully we will see that to be a successful strategy. Another one I'd like to point out is a new initiative down there at the bottom, Acá Entre Nos. It is an initiative working with some of our Spanish-speaking medical professionals who are holding sessions with community members to destigmatize mental health, finding that in the Spanish-speaking community, some of the biggest barrier to receiving mental health services is the willingness to have the conversation about mental health at all. And so when you get to hear from a Spanish-speaking medical professional about the importance of mental health, that has been helpful. So we are helping to organize those as an example of another initiative within the CHIP. Also just wanted to highlight that we are still working on and will continue to work on standing up the Washoe County Crisis Response System. That initiative is now, this is a continuation from the last plan. That initiative is now broken into 2 parts. There's a part working specifically on crisis response for adults and another part working on crisis response for children. We had good news at our meeting today. We actually just had the coordination and accountability meeting for that today. And the 2 of the 3 contracts that are necessary to stand up the Crisis Stabilization Center that we spoke to you about last year when we talked about the CHIP, have been signed, and Renown is saying that they think that they can have that center open by the end of the year. So that's exciting news as well. So still making progress. It's probably going to be 6 years from the time we started that initiative until it's fully stood up, but a good example of a cross-community collaboration that comes out of the CHIP process. Preventative health behaviors is another one of our focus areas, and on this one I'd like to highlight the Healthy Corner Store initiative. You've heard about this before. This is another continuation. So recognizing there are parts of our community that have food deserts, this is an initiative working with community partners to take that corner store, that convenience store that may be the closest or only available option for some community members, and have more healthy options by both supporting the business owner and the community members in that community. Another example of a continuing project is our 5210 Healthy Washoe. This is all about working with community partners on the 5210 system, which, oh my God, I'm totally going to blank on it. So 5 fruits and vegetables a day, 2 hours of exercise, less than 2 hours of screen time, 1 hour of exercise, and 0 sugary drinks. We were going to get there together. Thank you, District Health Officer Dick. And so that concept gets woven into lots of things. A big part of this initiative right now is working with the Washoe County School District to make healthy cafeterias. And so really reinforcing that messaging, reinforcing having fun things like little signs that have fun names for carrots or broccoli, or suggesting that they choose ranch with their vegetables so that we're more likely to have kids choose the healthier options. Access to healthcare is probably one of the more challenging areas that we try to tackle in the CHIP. It's rose as a high priority for the community. An example of a partnership that we're doing here is the Greet, Eat, and Meet program. So these are, again, small community meetings where we bring a speaker, we bring food, and when I say we, these are all community partnerships. The managed care organizations are involved, and you start with greeting and eating and meeting, and then also talk about, and then you move slowly to utilization of benefits and why and how they might be able to use their Medicaid health benefits in ways to achieve greater health. So it really is an engagement and outreach activity. The other one here is partnering with REMSA to lift up the work that we've all been doing together and the Choose the Right Care campaign to lift up the proper use of 911 and try to get folks into the appropriate care using our medical emergency response system, as another example. And then finally, language accessibility. And so we are working on language accessibility as the health district, but also the county as a whole is starting to work on language accessibility plans. And so our first step, instead of trying to tackle the entire community, is to work collaboratively with other departments within Washoe County on their language accessibility plans and see what we learned from that work in the first year. And then maybe we will expand from there. So ourselves, the county as a whole, and then from there, we'll look at year 2. So what's next? Implementation is underway. This is one of those processes while we're planning, while we're doing. And so we don't wait for the document to be finished and approved by you all to start working, because the community is, in many cases, already working in many of these areas. The owners and supporters of all of the plans are identified in the action plans. And so again, if you look at your document, you'll see that each initiative has an action plan that includes measurable objectives, action steps, ownership, resources necessary. Washoe County Health District will provide support for all of the committees and activities. In some cases, we are the lead, and we are the facilitator, and we're putting money towards it. And others, we're a member of a committee and somebody else is leading, because it truly is a community-wide effort. And then you'll get an annual report on how we're doing, and we'll do some updates for year 2. I think one of the most brilliant parts of the CHIP is that it is flexible. And so generally, we will see some things that are working and we want to continue, other things that maybe were a great idea but don't merit moving forward, and maybe some new ideas that will come in year 2. That's it for the Community Health Improvement Plan. If there's any questions, I'm happy to answer them.
Mr. Reese is grabbing the microphone.
Well, I am doing that. First of all, thank you for the presentation and the report. You and your team have done an outstanding job. I think one of the things that for me, that sets this report and the sort of action-oriented goals apart from other reports that I see, because we all see a lot of reports and plans, is this concept of having objectives and key results. And so it's the idea that we have a goal, we identify measurable ways to go about getting to that goal, which includes timelines, and then we're going to be held accountable for those goals over the period of time. And again, I don't think that's very typical. I think sometimes we get very creative with how we measure and view our goal setting, and so I think it's it's excellent. There was one in particular that I wanted to focus on, and it had to do with youth mental health, and I did spend some time looking at the report. In the last goal on page 28 of the report, it focuses on Black and LGBTQ youth empowerment. And one of the things that it's just absolutely heartbreaking is the indicators there of the survey results that identify the percentage of high school students who felt sad or hopeless, and the same is true for middle school students. And so for my part, I am very interested in following along in the metrics that focus on both the more equity-based inclusionary models and also the outcomes attached to that. I think some of the things that you talked about obviously focus on different target populations, but in particular, this one was meaningful to me and stood out. So again, thank you for the report. It is incredibly comprehensive. I hope that as we move along throughout the course of the next period of time, which this report is intended to cover, that we will be able to look back on it, and you and your team will be able to give us updates as to the measurables that have occurred once this report has really put into place. And so I'm excited to see it go into existence. Thank you so much.
Thank you.
Go ahead. Ms. Garcia.
Thank you, Ms. Ratty. I've been following along. I geeked out and watched your YouTube video. I think you presented to the District Board of Health back in December. Was it December?
She gives autographs.
But I was following along as a new board member. It's been really great to see it come to fruition today and see the final report, because the assessment alone was amazing. I use it all the time as a reference, as a way to gauge what's happening, particularly for me in District 3 and the zip codes that I represent. So I just wanted to say thank you. I didn't realize it would evolve again into the CHIP, which I was really excited to see. And in particular, in looking at the document and then hearing your presentation today, I was really curious about the items that you listed on the second to last slide, the what's next. And I guess my question is, I'm green, I'm new, but I know, coming into the BCC early in January, there's still a lot of folks, electeds, that aren't very up to speed on some of these terms, some of these even just basic mental health stuff or social determinants of health conversations. I know I really respected Mr. Dick for kind of giving some of that insight and education during our last strategic board meeting. But I guess to get to my question is like, how are we going to disseminate this so that this amazing document, these tools, what you've learned and gathered, you brought together so many stakeholders at the beginning. How are we, or what's the game plan to disseminate this so that folks can, A, use it as a tool, but B, use it to prompt other conversations or perhaps bring in additional community stakeholders?
So thank you for the question. Well, first of all, thank you to both of you for the compliments, and thank you for the question, Commissioner Garcia. It's a great question. I mean, we will do the things that you would expect us to do. There will be a press release that goes out about it. It'll be highlighted on our social media feeds once that, of course, assuming that it has your formal approval today. So we will do those kinds of things. We're working really hard at the community engagement side of things to not have one and done relationships, but to have ongoing relationships. And so particularly with our health equity team and the different team members who are leading parts of this, they're charged with regular community engagement and staying in touch with the folks who helped us to create the plan. Many of them are working communities, so it's not like we had 150 people at a forum and then we just don't ever talk to them again. And so in that way, hopefully the CHIP becomes part of, for and by the community, by that rather large group of people who are continuing to work on it. I think your other question about getting it to the elected level or getting it to some of the other community leaders, we probably need your help on. That's the model of a district board of health, of course, where you all go back to your respective bodies and hopefully make sure that they're aware of it. And of course, we would be willing to do anything that you would request to help with that. We can do one-on-one meetings with different elected officials or leaders within community departments, really anything that you think sitting in your seat would, knowing that all of the things that people are trying to absorb would be the most effective to get to some of the folks that are targeted. So I think we have a better plan for community-based and making sure that we are continuing to keep our community-based partners and would always love to have your help for the rest. I was remiss on two things. First of all, Rihanna Lavoie is not here today because she is out on leave, but she has been our leader and taskmaster and facilitator and is the one who has been the person to make sure that we have measurable outcomes for everything. That is her piece, so I do want to give her credit. I also want to give credit to a number of folks, obviously the assessment coming out of our EPHP division, which was the foundation for this work, and then all of the steering committee members who have stayed with us for the long haul to also stay engaged, because I think that steering committee will also be part of our team, which will help to make sure that this gets dispersed within the community as well.
You know, one of the reasons this thing works so well is because it is everybody's input, and it's a lot of people's work, and that you did go out into the community, the whole team did. And so I think it's good, and I do want to echo what was said, and I think I found this in anything we've done is really the what's next. These guys have a lot of work that they do internally, but getting out there, it really is us. And it is our ability to grab people and go, I mean, from crisis stabilization, once that thing starts rolling, there'll be a thing. But we get so many invitations to stuff, they just kind of pass through some people's mind or whatever. But if we grab our other city council or other people and say, come, and you know, the people we know, so, you know, you need to be there, come be with me. That kind of stuff really does help, and even other stakeholders of the community. And so I think it's fantastic. I do have a couple questions. One is, are we working with RTC on the transportation piece at all? Have they been informed of that assessment?
Julia Reddy, for the record, yes. The short answer is yes. RTC attended a lot of the meetings. It is, the CHIP is decentralized. And so in having the transportation as a cross-cutting consideration, what we're asking is that the committee that's working on 5210, for example, is considering transportation when they organize a event. And so what that might look like just is that the facility that is hosting, for example, a GEM Greet, Eat, and Meet event is considering whether that is on a bus line, or is actually making it neighborhood-based so folks don't have to go to travel far to get there. So it's a consideration in the planning of it. There may be other instances where we want to do bus passes, or we reach out to RTC because we do need some extra transportation. So it was less about building new transportation infrastructure or programs, and more about making sure that whenever we schedule anything or do anything within these initiatives, that we pause and think about, do we need to do something on this one on transportation, and do we need to do something on this one on language accessibility?
If there's anything practical like that, I would just ask, and I think you do ask, but just to remind.
And RTC is at the table.
We would love to make sure that the right people at the table, and not just at the table, but feel the correct pressure from all of us to do what we're asking.
They've been very good.
So the other thing, a question, and I do want, well, it's just a question, I just want to say, part of this CHIP, what it does for us, even at legislation, with some of the things coming down the line, we are prepared for some of the finances that are talked about coming to us because we are organized, and it's a great job. I mean, I say this to your whole team. I know you're going to always duck anybody who compliments what you do because it's the whole group of people doing it, so I understand that. But I can say that it's huge that we have this in place because we'd be running really fast to try to get something in place if not. And then I think my final thing is on the mental health. Was there any talk about licensing, the licensing issues on the legislation on a statewide level? Do you know if that's a piece of your conversation or not yet?
There are many conversations. So the health district and my team members participate in a statewide working group for workforce development. And that working group has 3 subcommittees, one focused on public health, one focused on behavioral health, and one focused on just primary care. And so in that forum, we are having all kinds of conversations about licensing compacts, so that it would be easier to do transportability between one state to another, legislation around licensing standards, all of those kinds of things. None of those conversations, those are still happening. There's still a statewide plan. They just didn't make it into the CHIP. So yes, the conversations are happening, but it didn't float as a Washoe County level priority, because what ends up in the CHIP are mostly the things that we can affect from the county level. And so we're more addressing that through that statewide coalition work.
Probably one of my final questions, and we'll kind of move on. I know we have a couple more things before we're done. Is it potentially wise for us? We're going to do a lot of work on this and even opening something and doing this, but it does us little good if we don't fix the process on a state level. This is my opinion, but from what I've seen. So we're going to work really hard, but I think simultaneously we need to, whether it means we put our own bill in or we help do something at large. So it's a conversation for another day, but it's a conversation I'd love to have, and a real one that we can all kind of understand and put our teeth into it, and as we walk forward. But I don't mind taking this next couple of years to make sure that's ready for the next session. Did you have something? Okay, very good. But that's it. Thank you so much. I know do we need to accept this?
Yes, please.
Can I have a motion?
So moved.
We got a first. Do I have a second? I have a second. Any other discussion? See none. All in favor?
Aye.
Any opposed? Passes unanimously. Very good. Thank you, Ms. Julie Ratty. We move on now to review, discussion, and direction to staff regarding the provisions of the interlocal agreement entered into by the cities of Reno, Sparks, and Washoe County for the creation of the health district. Take action, accept the ILA in its current form, or direct staff to forward any additional recommendations for possible amendations to Reno, Sparks, and Washoe County.
Good afternoon. Mary Canderas, Deputy District Attorney, and I'm here to present item 13. Mr. Chair and members of the board, essentially this is your annual review of the interlocal agreement, which is the foundational document for the District Board of Health, soon to be referred to as the Northern Nevada Public Health, serving Reno, Sparks, and Washoe County. So unless you have any specific topics that you would like to consider for amendment, the recommendation of staff is to accept the interlocal in its current form, which was last amended in July of last year to change the name.
Does anybody have any comments, suggestions, conversation? Yes,
Mr. Chair, if I might.
Please.
Ms. Canderas, thank you for the explanation. I suppose for my part, I don't know enough about it. I received the staff report. I received the interlocal agreement, but I don't know whether my jurisdiction has contemplated its role in it, if it has any questions. Do you know if all, I mean, generally speaking, when we have ILAs between our various entities, at least our staff are behind the scenes somewhere working through them with us. And then by the time we arrive here, our staff has told us, hey, we're good to go. We've seen it. You know what it is. And I don't think that's happened here for me, at least at the City of Reno.
So I don't actually know the answer to that question, if there's been talks with the other entities, other local government entities. And as noted, we typically look for this amendment once a year. And so I can make sure that if we accept it for today, we make sure we reach out to the other city attorneys and at least kind of get the ball rolling as far as any changes. I haven't been made aware anyway of any changes that needed to be made at this point.
Well, and as I understand it, that the interlocal may be amended, is it 90 days before the annual renewal date of January of 2024?
That's correct.
So if, in fact, today I vote to approve it here in this body, wearing the hat I do here, and I go back home to the City of Reno and they say, man, you really blew it over there because we had all these things that we were needing to work out, but maybe they were asleep, I don't know, then we could come back.
Yes, I think we could. As you probably are aware, amending an interlocal between government entities takes a long time, typically anyway, because of the process that everybody's finance lawyers deal with the issues. In my experience, and I'm not talking specifically about the District Board of Health, if somebody needs an amendment, whatever partnering agency that is, usually they will bring it to, if I'm representing the agency, the regional agency, they'll tell me, and then I would usually kind of get the ball rolling. I don't think there's probably a formal way of doing this for the District Board of Health, but I don't want to speak out of turn. Like, I would have expected if there was talk of amendments that needed to be made, that I would have heard about it in
Well,
my prep for
unfortunately,
this.
each of our agency partners, we're all working together very well, and the managers of each of the entities and the mayors and the chair of this county commission will meet with some frequency. I don't know exactly how often, but I would have assumed that if there had been some grievous thing to be done, they would have done it.
I would like to think so too. That's been my experience.
Okay, with that in mind, Mr. Chair, I'm ready to make a motion when you are.
I have a couple comments on that just to help. One, did this go to the EMS before it comes to us or to come to us first?
The EMS is not a party.
They're not a part of this at all. No one else is. So I would say the one thing that I think goes for any of us, that if there's ever a question, this can always be taken back. We can always come back and say, we want to look at this. We've seen it happen before. And that's one of the privies that we do have. So I definitely understand that. And I do know that you're probably going to see some amendments potentially on some of this with some of what's happening in conversation anyway. I just don't know that it's fully ready to have the full conversation yet. Am I accurate on that?
Yes, that's correct. If there are any changes to the interlocal agreement in regards to those regionalization discussions, I think that's something further down the road.
Yeah, there's good potential. You've seen that. So I'll let you go ahead and do your motion.
Move to approve staff recommendation.
I got a first. Got a second?
Second.
Have a second. Any other discussion? See none. All in favor?
Aye.
Any opposed? It passes unanimously. Very good. Okay, we're on to our staff reports and air quality management. Francisco Vega, come on down, sir.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just a couple of things. I did provide some information in my report regarding the court's decision to uphold the EPA's endangerment finding. Also, for the last, probably 4 or 5 months, I've been including in my director's update that link to the EPA Small Business Assistance website. Just want to mention that's a really valuable resource for small businesses or any businesses within the region. But that's just one resource. Obviously, my division, the Air Quality Management Division, is available to answer or assist in any way. And we also have the UNR Business Environmental Program as well. So there is a number of resources out there available to you if you have questions regarding air quality management. With that, happy to answer any questions.
Thank you. Thank you. My only question has to do with did we get those buses? Do you know if that's moving along? I saw you sent out something for the school district. Did they end up getting the electric buses, or is that still in play?
Yeah, so I think the deadline is still upcoming, so I think they're still evaluating what the application is going to look like and the financial resources and things like that. So I think those discussions are still ongoing.
Thank you for the update.
Yeah, of course. Thank you.
Okay, we're moving on to community and clinical health services. Ms. Lisa Latritz.
Good afternoon. Again, Lisa Latritz, Division Director for CCHS. And I just have one addition before the next Board of Health meeting. I believe, yes, we'll be having the Northern Nevada Pride on July 22nd. And Washoe County Health District is sponsoring, one of the sponsors for this event, and have invited staff to join us to walk and participate. And we will also have a booth where we'll be offering COVID and Mpox vaccines that day. And so we just wanted to offer you guys, if you would like to walk with us and come be a part of that. And I'm sure Kevin Dick can give you information, or Aaron, or feel free to contact me as well. And that's all I had to add, but I'm happy to answer any questions.
Any questions? No. Thank you so much.
Thank you.
Moving on to environmental health services. Aaron Dixon. I hope you're about to talk about mosquitoes.
First on my list.
Thank you.
Good afternoon. For the record, Aaron Dixon. I want to add a few things to the report. We'll start with vector update. I have been sharing for a few months regarding our helicopter and our unexpected retirement this spring of the pilot. I do want to give you an update. We do continue to work with a new pilot that is attempting to take over the operations. There are still some licensing, some logistics, some insurance that need to be finalized before a flight can occur, but we are actively working with this individual to try to see what we can do to assist. As you're aware, we have purchased and received drones to also conduct treatment. We are in the process of obtaining FAA approval before we can fly. We greatly appreciate the DA's assistance with this process, as they are the ones that have to submit the paperwork on our behalf. We are hopeful that we will be able to move that process forward as well. And just so you are aware, we continue to monitor our mosquito populations. We actually have traps set around the community, and we can we provide an average for each trap of the different types of mosquitoes that are being collected in those areas. And we do have them all the way across the region. We are seeing mosquito activity. However, the mosquito activity we are seeing is not necessarily the mosquitoes that will carry West Nile virus, and they're not at the levels for those mosquitoes. They have not reached levels where CDC has determined disease transmission is likely. So while we may have some mosquitoes, they are not at the level where we would anticipate West Nile transmission at this time. But we continue to respond to customer complaints. We continue to go out when someone asks us to say, hey, we believe we have mosquitoes in this area. We will work with community members to help them mitigate their risk as well, and do some minor treatment spots, just not with the helicopter at this time.
I'm going to pause and just make sure there's some questions, because there's a lot of conversation, but I don't know if you guys have gotten anything. I have had more conversation about mosquitoes in the last 2 weeks than in a long time. Yes, so
absolutely. What kind of questions?
One of the question I do have, so if there's an uptick, and I know we're waiting for license, are we just stuck? Is there something that we have that we can go do to help mitigate some mosquito? Are we prepared? I believe we are. I just want you to say it out loud.
Yes, we are prepared, and we are planning for different scenarios. We can do spot treatments we always prefer larvicide. And so that is what we're still doing right now. And we won't be going to adulticide at this time. We don't see that risk, but we will do spot treatments. We are also Mosquito fish are also available for anyone who has a water source, and we provide those in the community as well. But we do the smaller spot treatments as well.
Thank you.
Any other questions on mosquitoes before I move to the next topic?
Mr. Dick.
Yes, thank you, Mr. Chairman. If I could add just a couple of other things. So we've had a wet spring, and there are lots of bugs out there. That doesn't necessarily mean there are mosquitoes. And so I know there are some areas where we've received some complaints regarding mosquitoes and people's windshields being covered with them and that type of thing. And those are likely to be midges that are in those areas. And we also it's important to recognize that as a health district, this is a vector-borne disease program, and we're not a mosquito abatement district, and we're not, set up to respond to nuisance complaints. So hence the surveillance that we're doing and watching those levels. And lastly, I wanted to let the board know I have been invited to provide a presentation for the Board of County Commissioners next Tuesday.
Very good. And so I would say, again, to those million people listening out there, if anybody is, there's a responsibility that we ask that you do to make sure you don't have standing water, make sure that you're taking care of things appropriately, and because you can help us a lot to make sure that we're just not getting chewed up by mosquitoes, because again, this is to help make sure we don't spread disease is the program we do. And so getting a mosquito bite, we can't stop that. Cool.
Thank you.
You got another?
Yeah, I have a few more things if you don't mind.
Go for it.
Okay. For under the food program, our team has met with the owners of the Reno Roots Kava Bar to discuss the multiple options available to them. The owners have decided to appeal the denial to brew kava, and our team is assisting with their process to go through that appeal process. And thank you to the vice chair for engagement throughout this process. Pools, I've mentioned over the past few meetings that our pool inspections have been a little challenging this year. And it was reported in the media that Southern Nevada Health District has shut down the pools at Planet Hollywood Resort on the Strip for some of the same reasons, some of the issues that we're seeing up here as well. We don't have any one that is violating the rules that badly. But it's just nice to know that Washington County Health District is not the only region experiencing some of these issues with the pools. And we do hope that Planet Hollywood can open as quickly as possible, but nice to know that we are not the only ones experiencing that. I want to bring to your attention that the Sewage, Wastewater, and Sanitation Advisory Board is scheduled to meet again on July 6th to hear a variance. The outcome of that hearing will either be before you in July or in August. And finally, right before we came down to this meeting, it was announced to me, and I'm very proud to share the news, that 2 EHS inspectors, Olivia Alexander Leader and Mia Zeb, they wrote an article titled Active Managerial Control, Implementation, and Insight. It has been accepted and will be published in the July-August issue of the Journal of Environmental Health. And so we will make sure that you have a link to that article.
Very cool.
And that is all I have. In case you have any additional questions.
Congratulations.
Anything else?
Thank you. So you have some big shoes to fill back there. Next time you're doing it, right? Okay, we're moving on. Epidemiology and public health preparedness, Dr. Nancy Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. Just to add on to Ms. Dixon's mosquito thing, if you're interested, we do have an Epi News series that we just wrapped up on mosquito-borne diseases, covering West Nile virus, your St. Louis encephalitis, and our Western equine encephalitis that's more occurring in the area. So if you're interested, go check out our website for that. It's all posted. Anyway, for my report, I don't have anything to change or add, but a few other highlights. In the month of May, there were 18 declared outbreaks that we had. That's a 14% drop compared to the uptick from the month of April, which is good. And the majority of these are taken with an even split between gastrointestinal illness and respiratory illness, and a small number of rashes. And just to update for awareness, the Marburg virus outbreak in Tanzania was declared over on June 2nd. The outbreak in Equatorial Guinea was declared over on June 8th. So during this outbreak, because of the high fatality of the Marburg virus disease, the CDC has been sending mobile phone text messages to travelers who have been in these two areas and are arriving in the United States, just to explain to them what symptoms they should be looking for, and if they do have any symptoms that develop within the 21 days to reach out to a provider. And since April, CDC has also been sharing travelers' contact information to health departments for situational awareness only, but didn't recommend conducting any risk assessment or monitoring due to the low risk at that time. But with these outbreak closures that's happening, CDC's contact information has discontinued for travelers, and any information that we've been receiving has also stopped at this point. So that's also a great news. And with our flu season ending on the low, we will not be distributing any reports during the summer as we did last year, because last year at the end of the season, we had a sharp case increase. However, our COVID-19 reports are still continuing, and coinciding with the end of the public health emergency, starting in the month of June, our biweekly COVID report is now turning into a monthly COVID report. So if you're not already on our listserv and would like to be and receive these kind of report updates, please reach out to me or any of our epidemiologists and have yourself added. That's all from me. I'm happy to answer any questions you may have.
Thank you. Any questions? I'll reach out. I don't get that report right now.
Well, I will try to add you then.
Thank you.
All right, thank you.
Health District Officer Kevin Dick, it's your turn. Get your update.
Yes, thank you, Mr. Chairman. Just wanted to highlight a few things in my report. Ms. Dixon is leading our effort to come up with reporting that we can provide to the board on our permitting timeframes in EHS. So we've had some people come with public comment in the past and complaining of long permitting timeframes. And so there are a number of reasons why permits may not end up being issued quickly that are independent of the health district and our review process. And so we're working to generate reports that will be able to inform you of permit applications that we've received that a permit hasn't been granted over a period of, say, 6 months or more. And so this is an effort that she's doing with technology services to extract this information from our Acela permitting system. However, that it's not a really quick and easy process so far. And we have to generate reports for the permits that come in through the counter at Washoe County, as well as the counters of Reno and Sparks, which each have sort of a different configuration under Acela. And so we're starting with Washoe County and trying to get that report squared away. And then we'll be working with the jurisdictions of Reno and Sparks to try to get the similar reports generated that we'll be providing to the board. So that effort is underway to be able to have better information and transparency for everybody. And then also wanted to mention it's been about 10 years since we had our fundamental review done for the health district, which was a great effort where we had a third-party team come in and look at how we're doing things, and they provided a lot of really good recommendations for us. And so I think it's a good time to take another look coming out of COVID. Obviously, a lot of disruptions with that. And so Ms. Dixon is going to be working with me to begin that effort, probably with CCHS and clinical operations is the first area we look at, get some independent assessment, and then move around to some of the other divisions. So, excuse me, allergy season. So we're working on that effort, trying to identify a good third-party group to do that evaluation, and we'll apprise the board on that as we move forward. And then also wanted to provide some updates Joelle Gutman Dodson is not here today because she is on a very well-deserved vacation. But she did an incredible job for us during the legislative session. And so I did provide a summary of some of the bills that we were paying the most attention to and working on during the session. But I just wanted to highlight a few of those. SB 92, that was the sidewalk vendor, that bill that one did get passed and signed by the governor, and I don't believe there were any significant changes to that from the last update that I provided to you. SB 118, which was our top priority for the legislative session, was passed and approved by the governor. There was a lot of activity and work on this bill during the final days of the session. And so there were some changes made to this. What we ended up with was getting a $15 million appropriation statewide for the Public Health Improvement Fund dollars we were looking for that are for then distributed to the health districts and to the Division of Public and Behavioral Health based on the populations that they serve. And so it's set up in the bill for us to get 16% of that funding, which is $2.4 million. We were successful in having it set up so that we didn't have to spend it by the end of that second year of the biennium and then or turn money in. So we have until the end of the following year, the end of June of 2026, to be able to spend those funds. And in the bill, so these are non-categorical funds that the board can designate how they're invested. And in the bill, there's a requirement that we report back to LCB at the end of each year of what the process was that the board used in making the decisions of the priorities that they invested that funding for, and what we achieved with those investments. And so, as our chairman mentioned, we have the community health assessment and the CHIP, which are good foundational documents for that. We also have the work that we've just recently been doing with the National Public Health Foundation and the foundational public health services and where our staffing gaps are. So I think that we're in really good position for how we're going to approach that and be able to report. We're in conversations with the other health districts and with the Division of Public Behavioral Health. And I know Julia Peak there is very on board with us all working together to try to develop sort of a consistent process of how we're approaching this that we can report back so we don't have a weak link that might bring us down in those reports and how we're approaching using these funds. And so trying to work together to do sort of a similar process, similar format, and that sort of thing, how we approach it and report on it. And then I guess one other thing to add, while we would have liked to have gotten the funding for both years of the biennium, the real critical need that we see coming is when we end our upcoming fiscal year at the end of June of 2024, and that's when our COVID-19 grant funding runs out. And so we would like to retain some of the staff that we've been able to bring on with that COVID grant funding. And so this will provide us the opportunity to get that funding infusion to do that. Also, while we wanted to achieve long-term sustainable funding, the original goal was to try to get part of the other tobacco products tax. We weren't able to do that, but we were able to get in the record on both the Senate and the Assembly side that the intent of this legislation is for this to be sustainable funding in the future that's incorporated into the Division of Public and Behavioral Health budget. Also significant, I think it is that Allison Ganko, the Health Resources Officer for the governor, testified in support of the bill and that continuing funding during the hearing that was held the last Sunday before the end of the session. And so that doesn't happen very often, and I take that as a really, really good sign, and we'll be working with the governor's office so that hopefully they will be able to empower the Division of Public and Behavioral Health to be able to have that money included in the budget moving forward. And then SB 172, that was the bill that provides for minors being able to receive STD, contraceptive services, and PrEP without parental consent, was passed and signed by the governor. So that's very important for us. And then the SB 237, which is really critical for our crisis response and stabilization system moving forward. That was passed and approved by the governor, so that established the surcharge for 988 and other crisis services as being 35 cents per line, and clarified that that includes all mobile telephone lines. So that provides, I think, something like $15 million a year is the estimate on the funding that's going to bring in. But that was really critical to be able to see those services move forward and have funding sources. So that's my update. Be happy to.
Lots of going on. Anybody to share or anything?
I've got a few comments.
Sure.
I'm very glad that we're finally going to start looking into some of the things we've talked about for a long time, and that's many of the board members, new and old, have talked about, are we meeting the needs of our community? Kaizen with Ms. Ratty's, CHIPS program, and we're glad to see it's about time that out of where COVID, that we're going to start looking into, are our different divisions meeting what the community needs, what adjustments need to be, plus and minus, and going ahead with the idea of every year doing one different division and looking into our responsibilities. I do want to mention that we've made some preliminary contacts just with different groups, so we'll offer you that information to outside groups, so they're not local, that can really come in. They do it for a living out in other places looking for it, so we'll certainly offer all that assistance. And I'd very much like to make sure that we maybe have a monthly update in your report of where we are with this, because I think it's very important. And starting with our clinical services, mostly because it's the most forward-facing thing that we do that the public notices. People will notice when there's fire and smoke, but they don't notice some of the
I'm just going to move into 15 because we have board comment, and it's appropriate for you to share, but if you're going to, I have my lawyer staring at me just a little bit. And so you're fine to keep continuing, but we're opening 15 so you can continue. We have a moment for board comment, and I know Mr. Reese has something as well.
I'm sorry.
No, you.
I'm moving to 15.
But you can continue to chat.
Yeah, no,
Matt, that's board comment.
but I'm very glad to see that we're finally making these kind of efforts. We've been a little tied up doing other things the last couple of years, so we're kind of getting back to normal, I hope.
That's good.
Me too. Yeah.
Very good.
I'll wait for 15 for board comment.
We're on it. That's what I'm saying.
Okay.
We're on it now.
I do like to have a monthly update in your report. It may not be long, but at least this is where we are this month. So, and whatever cooperation we can help you with, we're here.
Well, the only thing I would say to that, and I know we're not I'm interested in just seeing where this goes, opening up, seeing where we're at, and we're just looking for updates. So that's the idea. So, Mr. Reese.
Thank you, Mr. Chair. I wanted to just share with my colleagues a couple of things. First is that, Mr. Chair, you have tasked each one of us with being sort of the liaison to various divisions, and I think that's been a very wise choice. For my part, I am responding to and therefore learning about EHS, and I just want to say thank you to the EHS staff who's been very gracious to me with their time. Ms. Dixon, the Englishes, it's been very easy to learn about this organization, and so in that regard, part of my reason for interest in it has to do with the kinds of constituent comments that come to me. And I want to just again give a shout out to our health officer and also the staff for being very responsive, because the kinds of things that come to me have tended to be in the vein of a business owner who's having an issue with compartmentalized sink rules. Right, something I don't know anything about. So I have to go to the health officer and then go to the staff to learn about it. And it's been very easy to do. The second thing is another sort of additional shout out. In that process, what I have learned is oftentimes the person who is the angriest about the thing and is pointing the finger at the health district for having done a thing is usually the one who is guilty of having created the conditions under which the thing has gone off the rails. So what I have found is that our employees here at the district are doing a very good job of working within the regulatory framework that they operate under. And so, again, thank you, Mr. Chair, for sort of identifying for us the various divisions and asking us to liaise with them. I will, for my part, too, share that I have met with Dr. Novak. I have spent time working with the folks who are involved with this CAVA question. I am scheduled to do some tours in August of businesses going through review for food and restaurant inspections. So I'm trying to learn what I can and also to bring that knowledge back here to the body. Again, thank you to the chair for your leadership and sort of dividing the tasks out in that way, just telling you what I'm doing in my obligations to do what you've asked us to do.
Thank you. One board comment I would have that I just wonder if we could at some point put on our thing, let everyone give an update of what they've found, so we all can learn. What are the highlights? What's one thing that you'd say, hey, you better, I'm not in that meeting, but I need to know what's going on there. Good, bad, ugly, whatever, in the sense, but usually good. And just that might be a good something to process. So, anything? With that said, okay, we are now ready to adjourn. Have a great day.